very distinguished comrades, brothers and sisters from the print and the electronic media. PSI AFRICON 2025, health workers in conflict zones, demands protection, investment and dignity. Frontline health workers from across the African and Arab region converged in Accra, Ghana, and shared their testimonies of extraordinary courage in the face of relentless violence. Public Services International's regional conference features workers from one Palestine, where nurses and doctors are trying to work in facilities that have been damaged or destroyed, often without electricity, clean water, or basic supplies, under constant serious surveillance and bombardment. Our colleagues have chosen a noble profession. To be a health professional in Palestine, it means you've chosen a profession where you wake up in the morning and you don't know if you survive the day. In Cameroon, health workers feel caught between armed groups and state forces and describe each shift as a constant balancing act just to stay alive while treating civilians, and where rape has been part of violence against healthcare workers. In Nigeria, paramedics and other staff report extreme insecurity on the roads, including incidents of ambushes and kidnappings when they try to reach patients. 3 of our members in 2022 were kidnapped, with one member getting tetanus and dying in the hands of bandits. In the case of Nigeria, we have a young lady who is here from the Nigerian Nurses and Midwives Association, who openly gave testament as to how the bandits actually kidnapped her with another colleague, and she stayed months there. She will be here to also talk to the media. In Democratic Republic of Congo, where workers describe evacuating patients during active fighting and then returning because they know communities will otherwise have no access to care. Despite overwhelming challenges, shortages of supplies, destroyed facilities, and chronic understaffing, health workers continue to stand on the front lines with extraordinary resilience and dedication. Their unions report increasing levels of trauma, burnout, and moral injury as conflict intensifies across multiple regions. Health workers are risking everything to save lives. No worker should have to choose between their duty and their safety, said Danny Betosa, PSI General Secretary. Attacks on health workers are attacks on humanity itself. The international community must act now to uphold international humanitarian law and protect those who protect us. The African and Arab Countries Regional Conference, AFRICON 2025 of Public Services International, PSI, is taking place in Accra, Ghana. This from the past 2 days we have been here at a moment when public services and the workers who deliver them are facing unprecedented attacks across the globe. The 14th session of AFRECON brings together hundreds of trade unionist frontline workers and allies from across Africa and the Arab region to confront this escalating threat of austerity, corporate power, conflict, and privatization. Delegates will set a bold 5-year program of action, charting a roadmap for strengthening quality public services as the foundation of dignity, equity, and democracy. A central focus of African 2025 is the rising danger faced by health workers in conflict zones, including those in Gaza, Cameroon, Nigeria, and the Democratic Republic of Congo, who continue to deliver life-saving care under direct attack. In many cases, hospitals and clinics have been bombed, medical convoys obstructed, and health workers threatened, harassed, or killed while carrying out their legitimate duties. Our members in conflict areas tell us the same thing. They are exhausted, they are targeted, and they are being asked to perform miracles without the tools they need, added Daniel Obeko, PSI Regional Secretary for Africa and Arab countries. We need investment in public health systems, respect for workers' rights, and immediate measures to keep health workers safe. AFRECON 2025 will develop coordinated regional strategies and global demands, including 1, immediate protection for health workers and health facilities in accordance with international humanitarian law. 2, an end to attacks, blockades, and interference with medical missions. 3, public investment in resilient, accessible health systems and decent work. 4, accountability mechanisms for violation against health workers. And 5, strengthening, organizing, collective bargaining, and union representation across the region. This year's conference provides a crucial platform for elevating frontline voices and shaping a collective response to mounting crises. The outcomes will inform PSI's global strategy leading into the next World Congress. PSI represents over 30 million workers in 154 countries and territories, including thousands of health workers who continue to deliver essential services in the most difficult conditions. AFRECON 2025 reaffirms PSI's commitment to defending public services, protecting workers' rights, and promoting peace, dignity, and justice across Africa and the Arab region. I thank you. So, comrades, brothers, and sisters from the media, it's my pleasure to invite the General Secretary of PSI Global, Comrade Daniel Betosa, to add his voice to the content of this press briefing. Comrade, yes.
Thank you, Brother Ademi. There's a crisis the world must know about. Around the world, health workers are delivering care under conditions that no workers should have to endure. In Gaza, Cameroon, Nigeria, the Democratic Republic of Congo, Sudan, and many other places that are conflict affected, Hospitals are bombed, ambulances are attacked, and medical staff threatened, harassed, and killed. These are not isolated incidents. They are part of a growing pattern of disregard for international humanitarian law and for workers' fundamental rights. And sometimes this is extremely obvious and explicit, as we've seen in the case of Gaza, where the Israeli government has accepted that it carries out illegal double-tack bombings, where they bomb a hospital or a workplace, wait 15 minutes for the first responders to arrive, and once they've arrived, they bomb exactly the same place with the deliberate intent to deter those workers doing their job to care for those people who've been injured. Health workers are not targets. Health workers are neutral actors whose sole mission is to save lives. Attacks on them are attacks on humanity itself. When a health worker is harmed, an entire community loses access to care. In this case, the frontline realities matter. The lives of those individuals matter, and we should hear about those. Brother Adeyemi has outlined some of those cases about individual workers, real people, and we will hear further details about that in this press conference. These are workers who continue to show extraordinary courage. But courage is not a policy. Protection is. I'm here as the General Secretary of Public Services International to show our support and to say that Public Services International stands firmly with all health workers and their communities and their families in all conflict zones. We insist on immediate protection, respect for international humanitarian law, and safe access to patients and medical facilities. And we reject the normalisation of violence against essential workers. We demand that they stop all attacks on health workers, health facilities, medical transport without exception. We demand open humanitarian access and the removal of blockades that prevent life-saving care. We demand that we hold perpetrators to account for violations of international humanitarian law and war crimes. We demand that we invest in strong, well-staffed public health systems so that workers are not left alone in impossible conditions. And we demand the assurance that unions can operate freely to organise and defend their members, even in conflict settings, without being targeted either. Now, the cost of inaction is very, very high. This is not just about health workers. Everybody suffers when this practice continues. When health systems collapse, communities face outbreaks, hunger, displacement, and preventable deaths. Violence against health workers deepens humanitarian crises and prolongs conflict, and this is avoidable. Protecting health workers is not optional. Protecting health workers is essential to restoring stability and dignity. So, this AFRICON, as has been stated, brings together unions from across Africa and the Arab region, but the eyes of the world are watching. And these unions, many of whom are directly affected or supporting colleagues in conflict zones, and we will hear more about that in a moment. We collectively demand these things, and we collectively across the world demand these things, and the world is watching. Healthcare workers show up for their communities every day, even under bombs and bullets and threats. It's time for governments and the international community to show up for them, because they need our protection if they are to protect us. PSI will continue to fight locally, regionally and globally for the rights, safety and dignity of every healthcare worker everywhere, and we will not cease until those rights are protected and those workers are able to give us the care we deserve and need with the care that they deserve and need. Thank you very much.
Yes.
Ladies and gentlemen, we are the Public Services International. We are a public sector organization or a public sector union of 30 million people. in the Africa and Arab countries, we are about 1 million. And health sector workers are part of the workers we organize. Our sister is not ready to expose herself to the media,
Yes,
but she
protection.
shared very worrying testimony. Our sister's name is Afiniki Bako. She shared worrying testimonies about how she was kidnapped as a health worker due to conflict. Brothers and sisters of the media, we are the people who make life easy for everyone. And so if you bomb us, if you destroy us, if you make us die, you are destroying society. And so our AFRICON is calling on our government, intergovernmental bodies, is calling on various organizations to protect people, to protect society, to protect health sector workers in conflict zones and public sector workers in conflict zones. We are those who make society work. And so if you destroy us, you are basically destroying society. We need peace, and everyone must enjoy peace. Cho bye! Cho bye! Cho bye! Solidarity forever!
Solidarity forever. Solidarity forever for the union.